tuna complain hivi about this SHIF and NHIF? Is it because haitusaidia ama?
Haitusaidii.
Yeah, that's the thing. Ndio maana watu wako unasema wenye wamebenefit. I'd like to see them.
I will tell you. And you actually know some of them.
But this is the fact.
Yeah.
Most people
remit
do
their
not.
funds.
We remit for sure.
And
but we do not get the benefits of the
Yeah.
funds that you remit.
Yeah.
That's why it's a problem. I've had the privilege of living in a developed country. And their insurance is actually mandatory. I'll not say that again. I'm sure they have it for the
your
first time.
privilege is showing.
But
Your privilege is showing. You've
this
had
is
the
the
privilege
point.
of living outside abroad. Utatuambia ni wapi ama?
Can you stop it?
Watu wanaita Uganda abroad. Please.
Nimesema developed country. So this is what I was going to say.
Let me just talk to the people who are calling Uganda and Tanzania abroad. Hapa ni mahali unaweza enda nika kwenda ushago, please. Easy places before the white people came and put boundaries. Ilikuwa tuka kwenda ushago. Please, abroad is abroad. Let's stop calling neighboring countries abroad. Somalia is just Somalia.
Before I lose my point, this is what I was going to say. There's one thing I noticed in a developed country.
Israel.
Insurance is a sister. You can't just chill. But this is the point.
I'm like a child.
In a developed country,
Yes.
insurance is mandatory.
Praise the Lord.
Yes. That is not something to bargain.
Yeah, because we said NHIF is struggling because it's not a law. Yeah, so
Alafu, apart from it being a law, your insurance yenye ni mandatory. Unaona venye says if you're employed, it's mandatory for your employer.
Yes.
Employer to deduct NHIF to not deduct, remit. It's not mandatory because it's mandatory for them to remit.
Yes.
Remit, deduct. So this is
well,
the
they
thing.
are deducting. They're not actually doing it from the goodness of their heart. They deduct, bana.
Yes. Remit is the thing.
Yes,
They should remit to NHIF your contribution.
Yeah.
But sasa
yours and theirs.
Pale nje, the insurance actually benefits you.
Yeah, you can actually cash on it.
You can access so many things. So just your 500 or your says in NHIF ni how much? Depending with the tier. Let's say 1,300. Let's just say 1,000. Let's talk about 1,300 or even the 500 that are self-employed.
Yeah, let's use the bare minimum. Let's use 500, Bob.
That 500 is going to help you if you have an eye problem today. That 500 is going to help you. I was at work and then I got an accident on my way to...
Is it any hospital? Because in Kenya, NHIF, you register in your hospital.
It's not any hospital, but it's in most good hospitals.
No, nasema like you are allowed most hospitals. Because in NHIF, you choose
Bora
a hospital.
Place penye Kardashians gave birth, but that means you can access so many other good hospitals.
Wow, the people who brush shoulders with Kardashians. No, I'm saying premium. NHIF, you have to register a hospital. Like lazima register hospital yangu ni X. So you go there for care.
Pale una register hospital iko karibu na wewe.
Yes, but you are allowed other hospitals.
Yes, okay. And it's a good hospital.
Yeah,
the point is the
healthcare.
Facility is well equipped. Yeah. You will get whatever it is. You will get whatever help you're looking for.
Man.
Yes, and that is our problem. That's why we are complaining about NHIF and SHIF because it was contributing 2.75% of 25,000, which
from
is how
October,
much?
Guys, from October.
You see pesa mingi. It's not a lot of money. I would not be making so much noise about it if it was helping me.
Yes, that's
but
the
problem is if I get sick today, a proper one, not leave alone getting sick. If I just get an accident,
yes,
and I'm
ordinary
only depending
accident,
on
ordinary
SHIF
accident
or NHIF, I may need to form a WhatsApp group.
You must. What do you mean? You mean?
Yeah, I actually must.
You must.
Exactly.
Yeah.
That's our problem.
Yeah.
If it was helping us, I don't think we'd be making so much noise about it.
Yeah, so we are going to be remitting 2.75%. And I think the only people who are going to benefit are people earning 20 or 24K thereabout. It may reduce kidogo too. But for the rest...
Because I know if you're earning 500,000, you should be contributing around 13,000 and some few hundreds.
Can you imagine?
Yeah. And you know for sure it would only cover like your bed if it's inpatient.
And let's be honest. If you can afford to give 13K out of your salary, you definitely have insurance. Like you're not even mincing your words with the insurance. You're like, I'm not playing those jokes with NHIF. You are definitely getting insurance. Like you have insurance on the side. But if SHIF was working or NHIF was working, we would then not need to have further insurance that is very expensive. And I understand where employers are coming from. Even when they try to swindle you out of insurance.
Swindle you out of...
Yes, they negotiate you out of insurance.
Become a consultant so that they just take out their 5% withholding.
Yes,
and then please, you can pay your insurance if you want.
Yes, do what you want to do with your life. If you want, join SHIF. If you want, do it. But SHIF was a really good idea. It really was.
The ideas are always very good. Policies are always like very good things on paper.
But just on policy.
Can
We
I?
don't-
Okay, go ahead.
No, when I'm getting.
I wanted to talk to, I'm getting Leo too. I wanted to talk to SMEs because this is the truth about our
Your
country.
people.
Yes, sisi kama SMEs, small medium enterprises.
Sisi kama entrepreneurs.
Yes, the employed people are a very negligent percentage of our population.
Unfortunately.
Most people are self-employed,
Yeah.
and they also go through
or lack of employment.
Oh yeah, they are what when you awana employment or
Hand
the
to
self-employed.
mouth.
So for the self-employed, these are some of the things I found out because for me, if there's one thing I really care about, is my health.
Capacity builder.
Maji na machungwa, Maji na machungwa.
And yes, we'll talk about that, like what we should do in terms of prevention.
Yes,
Yeah.
yes. So this is what I've noticed. I've noted that there are other like alternatives for if you do not have the privilege of your employer kikulipia Jubilee or whatever. I have noted that SMEs, let's say I am a consultant, you're a consultant, there are four of us, right? We can come together
Yeah.
and under one, like we can come together under my company and then register as an SME.
Yeah.
And we'll be able to actually get a better coverage because when it comes to, let me talk about AAR for instance.
Yeah, that works. You know that place that we used to work with where we will not say.
Where we will not say.
They used to do that. They used to come like 3 companies together
Yes.
and do that. Yeah.
Yeah, and I've noted it's cheaper or it's more affordable
It is.
if you go as as a crew,
As a group.
as a group.
Insurance 101, you pay out of a pool. Yeah.
So that is one thing you can try. Come together as the different consultants or the SMEs that you are. Uko na kabiashara kako pale Instagram. Come together with your friends.
Yeah,
take that
maybe you
insurance.
share a building. Just speak to like 5 people in that
Yes,
building. That's a great idea.
Then I've also noted like AAR has like very cheap monthly subscriptions, like 1,675 per month.
Per person.
Per person, yes, that is per person, and the,
Per
with the
person
goodness,
sharing or per
per person, per one person. But with the goodness of that is,
does it cover your next of kin? Not next of kin. What is this thing that people have? A family.
a family like
say your husband and your kids.
if I want my husband and my kids to be part of it, I may have to like add a little bit,
Maybe a G.
or a G to that. But
Which is still fair.
yes. And then the other thing, the only thing I noted is you can't access the tier 1 hospitals like Aga Khan, Mpisha.
Really?
Yeah, you cannot access tier. Kwani huko ndio kuna medical health peke yake, medical huko ndio kuna
No, I'm
madaktari.
surprised. Like because of why?
I'm
But
just
AR
letting
is
you know.
AR is what level? AR is I'm not sure level.
Sijui kama wamejilevel,
Yeah.
but it's a good healthcare facility.
OG level.
But you see, here's the thing.
Unakuwa
AAR
level.
is not only an insurance. They also have like hospitals.
See, that's what I'm saying. I
so
know
you
AR
pay the
has a
insurance
hospital.
and go to their hospital.
Yes, because AR is one of the major hospitals, especially ile nilijengwa pale.
Yes.
It's one of the biggest hospitals.
Pay the insurance
in
and
the
access
country.
their hospitals.
Yeah.
I don't believe I have to go to a tier 1 hospital to get the best medical coverage. So that is something I've just learned for SMEs that I wanted to.
Hopefully,
to
hopefully I
share.
can try reach out to them and ask them if I can even put a link. Yeah, because I mean, the goal is to help as many people as possible.
Oh, and this was not sponsored.
If you know, you know. But AR, hata mkiturushia kitu, sisi ni nani? Sisi ni watu wa Mungu.
We love
Unasikia tu,
sponsorship.
unaona sasa tumewasaidia bure. Yeah, wow, that's something. But yeah, my heart goes out to anyone. Let's speak about cancer, yeah? There's a book, shorter to Mungina, nafa kurudisha hiyo kitabu, inaitwa Beyond Silk. I've forgotten the name of that author, but it's a lady, and I will put it down here, Kenyan author. She speaks about how when the dad got cancer, the whole process to her changaring in Facebook, strangers giving them money, them taking the dad to India, coming back until he died, and even sustaining his health here. I don't remember if one of the siblings was in the medical industry because it's been a minute since I read that book. But if I remember, I'll say, cancer. You're telling us, if I have cancer now, okay, let's speak to a person in Mashinani. Amepata cancer. You're telling me the hospital cannot necessarily give me the result. So I have to go further.
They might have to send you to a level 5.
There's someone I know who... No, I don't know them. I listened to...
You saw them on social media.
I was like, how do I know them? Who was saying how they got their diagnosis of cancer was they had someone. Like, they were in a ward. actually, no, blind girl experience said this in one of her YouTube videos. Yes. She was with her in the same ward, and then they were transferring her to a ward for oncology, and she was like, why are you transferring me to that ward? The doctor had not even told her
What?
she has cancer. I know, that's such a bad way of learning you have cancer. But yeah, cancer is the new menace. I know.
And not just cancer, Jojo.
And she was
The
like,
NCDs.
I work here, I know that ward, that is an oncology ward, I know that is where cancer patients go, so what are you saying? They're like, wow, you are not told, your doctor didn't speak to you, but now this is mshaniambia. And you are a disease kills you before it kills you. Like the diagnosis can kill you before it kills you.
Yes.
Once I tell you have something, half the battle, if not most of the battle, is your mind.
True, very true.
There's a way news should be broken to people, especially news like that. Even the caregivers of this person. But anyway, cancer. You've had experience with cancer, or anyone you know?
Yeah, I had an auntie who died of cancer. My grandfather died of cancer as well.
But did you guys changa?
Did we? Not quite.
Yeah.
Okay. For my family, we have not really contributed for anyone.
Yeah, like
but
directly,
friends,
holding the torch, yani. Like you are just part of the people who are in a group. Me too. I think my grandma Unia, one of my favorite grandmas. Okay, I only have 2, but anyway. Yeah, I think she died out of cervical cancer, but yake ilikuja ikamaliza as quickly as it came. Yeah, I might be wrong.
Could it have been like a misdiagnosis, or they took long before?
I don't remember, because one time she was sick. Hey, Nikitambo, we were okay, not kids, but yeah. I remember it vividly because
were
my
you a
dad,
teenager?
Yeah.
That time cancer was still not as a big deal as it is right
because
now.
I remember I remember it vividly because of how my dad, it really affected him.
Must have been those days when those things were not like so easy to diagnose.
Mamake alikuwa mtu wake, so I remember it really affecting him. Anyway,
but you see, cancer is not the issue. They're called, okay, not, that's not a good statement. Wacha niseme, it's just not cancer. They're called non-communicable diseases.
Yes,
from diabetes, obesity, hypertension, cancer. And I actually was just...
they're called what?
Non-communicable diseases.
Oh, I'm going to eat a lifestyle diseases.
No, because it's not NCDs. The communicable diseases are like malaria and
yes, cold.
Yes, HIV and AIDS. Those are communicable.
TB?
TB is a communicable disease because like it's gotten through the, I cough, air.
Fluids.
Fluids. No.
I think so.
TB ni air, sis.
Na kukohoa ni gani?
Ya kukohoa si ni air.
Oh, okay.
Unaniangusha. But this is the point. Do you know, like right now, NCDs, cancers and hypertension and obesity and diabetes, they contribute to the 57% right now in Kenya of new admissions. It is that bad.
Yes,
and I think
if you read
a
about
big number of deaths as well.
The Health General Assembly in May 2024. Ni kweli. Kenya, we are really, the sub-Saharan part of Africa, we are leading in those diseases.
And imagine those diseases we used to call them magonjwa za white people.
Wazungu, we used to say that. Hizo ni ugonjwa wazungu. Kwani umekuwa mgonjwa na ugonjwa wazungu? It was comedy.
And now they're here. And maybe the last thing, towards the end of this conversation, we should talk about, like from my small public health experience.
Small.
It's small. Yeah, it was just a unit. Like some of the things we noted and things I think we can do better, going forward. But wewe mwenyewe, have you had like experience with the cancer? And
I think just contribution. Yeah, contribution.
And I mean, that's a whole conversation from caregivers and just the burden of...
And unfortunately, how cancer is set up in this country, you cannot manage that bill of health on your own. I've seen very wealthy people still have to call for our WhatsApp group.
Because it's expensive.
Even, like, it levels us. Whether you live in a slum or you are where, they still call for our WhatsApp group. That is how expensive cancer is, unfortunately. And also, ebu check yourself. Imanene ati mbona sikuambiwa kama mtu akona cancer. I am dying of a disease. You want me to carve out time to come and tell you?
No, wait. You're talking about people who complain when they're added to WhatsApp groups and they're like, why were they not told before they were added?
Even before that, yes, that thing of ati kwani nani anaweza kuwa mgonjwa na asemi Joturua, excuse me, because why? I should pack my disease and find words to tell Casey so that she is agreeable.
Yeah,
to
no,
this.
join WhatsApp group. Mbona unani-add?
Hey, check your privilege, guys. Check
Yeah,
your privilege.
very,
And
very
also,
important.
points to note, it might just land on your doorstep. It's all fun and games when it's over there. It's not going to be fun and games when it's on your doorstep. So yeah, that has been my experience.
Let's help when we can.
You must. Ubuntu. It's this thing is not even a thing. It's an African thing. It's within us. Even whether you believe in God or not, which I highly subscribe. You subscribe to.
You highly recommend.
Yeah, I highly recommend you subscribe to.
I highly recommend Jesus.
I highly recommend Jesus, but it's just Ubuntu. We always help each other. It's African. We help each other.
So let's just help where we can.
Yeah.
Mambo mingi. If you have a 500 or a 200 or 1,000 bob, the good thing with these groups is nobody tells you that it is 10,000 and above. Like
but also those who are asking, punguza entitlement.
Those who are asking?
Yes.
Why they were not informed?
No. Those who are asking for help. Like just because you see, I live in a very posh place, I drive certain cars. You have added me to a group and you're saying, kwani Jojo mbona janipea 1 million? Excuse me. My finances, tena. Unataka usaidizi lakini kiburi iko huko. Shuka. Cheka kama mrembo bana. Hii podcast nacheka.
Very demure.
Yeah,
like
very so
cute.
both sides, even as you're asking for help, punguza entitlement. Like you are asking for help. So ask for help.
So it's both sides.
Yeah, it's both sides. Yeah.
So what do we do about our cancers and our non-communicable diseases? How do we?
I think first things first,
prevent?
let's live a healthy life.
What does a healthy life look like for
Drink
you?
water. Mind your business.
Wachana kwanza na mind your business. Let's talk about drinking water.
Let me tell you guys, minding your business is part of not getting a disease. Because why are you stressed about people's lives? Always finding out and knowing things about them.
You're inakosa ugonjwa. Sikujua not minding my business might lead me
not
to...
minding your business is part of why you are struggling in life. So drink water.
Because hapo sasa naona ni kama you are addressing another
that is a personal conversation.
Please talk about drinking water.
So drinking water, I think also healthy, balanced diet. Easier said than done. But I'm going to talk about communities. There are people who grew up in villages where they used to eat in one house in a home. And I think that has really changed. But these CBOs, there's a way they come up with, even they supply fruits within themselves. Like hii wiki ni bananas and oranges. Next week ni apples and sijui nini. So if you cannot afford it for yourself, you can get into some sort of groups and setups. That's why I'm very big on building communities that help you access vegetables and nini. And also, somebody has lied to you that fast food is good food. Fast food is not good food. I'm telling you. And me, I eat fast food. I know I have a problem. But I am eating healthier. Because why? I don't want to be sick.
Can I tell you why fast food is not good food? First of all, it's not nutritious.
Hello.
It's way of preparation. It strips all the nutrients from it.
Yes.
You know, they're frying the chips, they're frying the chicken. And
over-salting.
Yes. So,
sugar.
The sugar, the combination yenye nafanyanga fast food nakuwa fast food makes it like very tasty. That is not good. Is the
hormones
salt,
zinamka.
Yeah, the salt, the sugar, and the fat.
Hello.
You see, like that is what fast food measures on, and that is very unhealthy for you. So why munambia mtu fast food ni unhealthy? Why? The method of preparation. So, and it's been stripped
the
of
nutritional
all,
values.
Yeah, so it has like very kidogo nutritional values, and then it has a lot of calories and a lot of sugars. Yeah. And also just apart from like fast food, and something else that I learned the other day, which I've been implementing, when you go to the supermarket and you want to buy your jam, your peanut butter and stuff, do you go and check the ingredients? Do you check how much sugar you're taking in one serving?
What is making that thing?
Yeah, we are not telling you to wake up today and stop taking Oreos or whatever.
Because you see Americans going to a supermarket and that's all they do.
Yes.
They're walking around reading.
So
to go like cheapest on the aisle. Just goes to show where we are.
Yeah, so I'm taking my peanut butter. I'm very healthy that I'm very happy that I'm eating peanut butter, which is healthy.
You have made it.
I'm eating peanut butter that has a lot of added
or margarine.
No, wacha niongele peanut butter because it is labeled as healthy. But this peanut butter that I've bought has a lot of added salt, has a lot of added sugar. Na imewekwa pia edible. Wamesema it has edible vegetable oil. You don't need that one. Just buy pure peanut butter, which is just njugu yenye kona salt.
Which you can also just make for yourself. Yeah.
If I cannot make for myself, I can buy a healthier version of it.
Yeah.
So yeah, just know that's why. And then like by the time fast food are also like very simple carbohydrates. And your diet should comprise mainly of complex carbohydrates. Complex carbohydrates ni your viazis, your sweet potatoes, your ugali,
maize,
your nduma and stuff.
Ngwashe.
And you know, but sweet potato
the
is
foods that nowadays, if you walk into a home and you find they've prepared for you, unajam na mtu anajaribu kukusaidia kuishi. Ati kwana wasa umetupia ngwashe. Ngwashe na chai. You want margarine and white bread, and you don't know that ngwashe is what is actually going to help you much more.
And we do that because we think the white bread and margarine is nikikula hizo sasa make it in life. That's the thing. That's the problem.
We have been lied to.
You know, when I was doing economic development, I learned that if you give a poor person money right now, you think they are going to buy ngwashe and skuma.
Can never be them.
What is
managu? What is managai?
They are going to get KFC
managai
and pizza and all that. So this thing that you actually think is now sasa nimefika place now I can eat whatever I can afford. You will eat whatever you can afford until you're 30 something or 40, and then now
it shows
this thing that all those things that I ate that I could afford, now I am using all the money that I've worked hard for
to not go back to ngwashe.
No, ngwashe ama sasa ndo nimeambiwa nisikule anything. I should not eat anything white. Now I should go back to eating brown stuff.
Do you know?
And I'm going to use that
now.
Money. Nini?
You have to go back to juicing.
Yes, the things that you are despised.
Yeah. I think we've bought into a bad narrative that the good things are the things that are hurting us. So we are here to remind you, managu, mboga, fruits, ngwashe, nduma, these things that some people grew up with. Those are the things you should be focusing. Boiled maize. Those are the things you should actually be focusing on. And beyond that, and I was saying minding your business because your mental health is also part of it. I know unacheka lakini ni very important. Your mental health is also part of your health because it forms part of your stresses. Imagine you live a better life when you do not get involved in other people's lives. Like if you just focus on a JoJo production, utaenda mbali, because now your mind is free from nonsense and the shenanigans of other people, because I cannot control what Casey does with her life. I can only control me, so I'm focusing on me. So my health, are you reading books? Are you listening to podcasts? Are you sitting in lovely conversations? Are you laughing with people? I mean, that is part of the narrative that keeps you healthy.
Very true. And lastly, I cannot leave this place without mentioning new stat. Nutrition.
If you know, you know.
Nutrition, good nutrition. So these are the keys to good health. Nutrition. The second thing, exercise. Most of us live a very sedentary life. We are always sitting behind our laptops, working from home or working from wherever. Please move around.
Let me give a major shout out to my friend who has gym money in her nini. And she's going to start hopefully next month. So let's do it.
Kama una gym, tafadhali tembea. Sawa. Nutrition, exercise, water, new.
And I think exercise, people think about the gym. Let's be, it does not necessarily have to be the gym.
That's
it can just be walking.
Please walk.
Yeah.
Nutrition, exercise, water, sunshine. Please go out. Usifike hapa ati unaenda ati hauna vitamin D. What do you mean? And you are in Kenya, in a tropical climate.
But part of water is also kuoga.
Mi sijui your message ni nani, but I was saying, please don't interrupt me
when your message waichukue.
Don't interrupt me when I'm saying new start again. Nutrition, exercise, water, sunshine, temperance. Temperance ni doing everything in moderation, okay? Whatever it is, even good things should be done in moderation. So that is T. Then A is air. Go out and take fresh air. No, you are living in your house and your windows are closed 24/7.
There are people who don't know how to breathe.
Then please open, make sure your house is ventilated. Then rest. That is one thing that you are really, really underestimating. We sleep for 3 hours and 4 hours and you're like, I can do this. Please take enough rest. Then that is
Apo kwa rest, can I just ask the people who are saying they will rest in their graves?
Siwongelei. But then new start. The last T is trust in God.
Yeah.
That is usually the last day of new start. But I'm
to
done.
me,
Mimi nimemaliza.
Lazima angekuja kutuambia.
Tufungie podcast.
To me, lazima angekuja kutuambia. Lazima angekuja kutuambia trust in God, yeah, because your life is not your life. Beyond that, I think here's the thing I'd like us to live with. Know the healthcare system. That's a very, very big thing. Like, know the healthcare system. Also, can you visit the hospital closest to you before you have to visit it? Because I think we treat things as an emergencies before. Like, you live in where? I don't know. You live in Parklands. You don't even know hospitals in Parklands. You need to know at least 3 or 2 hospitals within Parklands that you can go to. Because you might have access to insurance, yes, but by the time you're getting to your level 5 hospital, it's a dead man, it's a dead woman. So first, know the healthcare facilities around you. And healthcare facilities here include pharmacies. Because pharmacies have, some pharmacies, not, okay, I wanted to say most, but some pharmacies have clinical officers where you can get a diagnosis, which I think you have been privileged to. Like you can get somebody who tells you, I see you want to take this, why are you taking that? Know where you live and if you can get healthcare facilities. Number 2, I highly recommend build communities. And cases of the opinion that you might not have access to these people, but try. Banange, try. Amesema you might not have. Amesema you might not have access.
Kwa group yetu hakuna daktari. Sasa tutadu.
Itabidi moja yenu akwe sponsored. Sponsor even one person to go and study it. It's important.
Okay.
Yeah, so that you have it. Like and because of that, and it might be from a point of privilege, but that building communities, what that does, that it gives you an opportunity to have more than one opinion with respect to whatever symptoms you are feeling about a disease. Number 3, when you go to the hospital, I highly, highly recommend that you be very articulate and do not hide things from your doctor. Some people go in for a diagnosis and they're hiding some things. You know very well 2 years ago you were in surgery and you're not saying. They can recommend a medicine that can completely kill you and be known to them, and they are using your information. So be very upfront with your doctor and tell them how you're feeling, your history, because sometimes the way this country is set up, your doctor is not your doctor. Some people don't have family doctors, so they don't know your history. So be very clear when you go into a hospital. And like, if you're like me, you have learned today that level 5 hospital is not where you start your medication. And for the SMEs, kama dawa, tunasema, come together with your people and do what needs to be done. But thank you so much, okay, for joining us. What is your parting shot other than new start? What can you tell the people, your people? Tell your people. Tell your people.
Maji, please. Yes. Take care of your health. Prevention is better than cure.
Yes.
Anytime. Because I was going to say our doctors are stealing exams. But this is what
they are. No. Before we go, we have to tell them. Do you know right now, if you graduated any year after 2017, I don't think I can go for it. Like I walk in and I say, which year did you graduate? I'm sorry guys, which year did you graduate? You say it, I walk out. Sina ubaya. See, I don't even walk out kwa ubaya. Nakwambia tu, no, I'd like to see an older doctor. See, like your anxiety, I'm not sure if you know what you are doing. Yeah. Where did the rain start beating us?
I don't know. That's another conversation, Jojo. Let tumalize.
Yeah. So
prevention is better than cure.
And shout out to anyone who is in this medical profession and who is truly putting out their lives at risk every day and doing their job to keep us healthy. We thank you so much. 1,000 to 1,500 students graduate, and yet we are understaffed. GOK. Okay, this has been another episode of Long Story Short. Bye.